Hi, everybody from Tennessee, where we temporarily are. I'm happy to report got the rhubarb in yesterday, but the tomatoes and beans kind of froze in the last few days, so we'll have to replace those. Um, we're on global warming here, and specifically on a Senate bill, Senate 2754, which is directed at phasing down hydrocarbons. And I know a lot of you have heard about this before from previous presentations, so I'll make this concise. This bill, the American Innovation and Manufacturing Act, would phase down the use of hydrofluorocarbons. Hydrofluorocarbons, or HFCs, are very potent heat trapping gases, 1,000 times more potent than carbon dioxide. They're used in refrigeration and air conditioning, and they came about as a substitute for chlorofluorocarbons, CFCs, which used to be used, but turned out were very hard on the ozone layer. The countries of the world came together in the Montreal Protocol and figured out a way to phase down the use of CFCs. But it turned out that the replacement chemical that was used largely were HFCs, which don't attack the ozone layer, which has been good, but they do have this heat trapping ability. A lot of industry favors phasing down HFCs because industry has come up with substitutes for HFCs, which don't have the heat trapping ability. So that would be ideal if we could stop using HFCs, but we need federal legislation to have an orderly phase down and to be consistent with what the rest of the world is doing to phase out HFCs. The rest of the world, including the United States during the Obama administration, got together and came up with something called the Kigali Amendment to the Montreal Protocol. It was agreed to in Kigali, which is in Rwanda, to phase out most uses of these within 15 years. And so in a bipartisan way, Republicans and Democrats, with the support of quite a bit of industry as well as environmental groups, came up with legislation to do a 15-year phase out that would phase out 85% of HFCs. But unfortunately, it's got hung up in the Senate. It's opposed, or has been opposed so far, by the powerful chair of the Senate Environment and Public Works Committee, John Barrasso from Wyoming. And he's raised various objections to it, but he's kept it from coming out of committee. It's widely thought that if the bill gets out of committee, it would likely be approved on the Senate floor because it has quite a bit of Republican support, especially Republican senators from states where some of these substitutes for HFCs are being produced. Those companies that have been on the cutting edge and come up with these substitutes, they would like federal legislation so that the companies that are still making HFCs and the users who are still using them, will have to stop using them gradually. So anyway, we provided testimony to the Senate committee. They had a written hearing. They didn't have an oral hearing. We think that by writing in to our senators to encourage them to get this bill out on the floor where we think it'll be approved, that will really help make progress on this important issue. As Lavona mentioned, there's a companion bill in the House, and that would likely pass the House if it looks like the Senate will take action. But the main blockage right now is this Senate committee, and specifically the chair of the Senate committee. So that's that effort. The other action that Lavona mentioned is an action alert that we're working on with the Environmental Protection Agency. EPA, as you probably read, has done a number of things that are counter to science and seems to be quite hostile to science these days. And one of those proposals is a proposed regulation that would prevent EPA from ever using studies that are based on confidential data unless that data can be made public. EPA calls it the secret science rule, because they say, well, it's bad to have to use studies that are based on data that everybody can't see. Well, here's the problem. Those studies are largely health studies. They're studies that have linked various health problems with air pollution in particular. A lot of the regulations that have limited particulates and sulfur dioxide were based on health studies which showed that higher exposures to those pollutants led to bad health outcomes. Those epidemiological studies, of course, looked at individuals and their health outcomes, so they have confidential, privacy protected data about these particular individuals, their names, addresses, and so forth, that our health laws prevent disclosure of. But that doesn't mean that the studies aren't good studies. They get peer reviewed, and they are very necessary for passing regulations. So, and you might have read recently about a Harvard study that linked areas of the country that had higher levels of particulate matter pollution with higher levels of death from COVID related disease. And EPA doesn't want to have those studies like that used. There are also studies showing that the SARS virus in China had more fatal effects in areas with higher pollution. So using these studies is very important for protecting health and protecting our environment. And scientists widely and environmentalists have condemned this EPA proposal. UUSJ and other groups have written in and opposed it. But the comment period is still open until May 18th. So we encourage people to write in, and there are details on the website on how to comment on that proposal. So that's another thing that we can work on here in this period where we can't do in-person testimony. We can send things online.
Very good. Thank you, David. Why don't we take some questions now, if there are any? And I'll need some help maybe seeing who might have questions. The other option also is under participants. If you click on the participants, you can raise your hand.
Looked to me like Diane and Ursula had questions.
Okay. Diane, why don't we start with you?
Thanks. I just had a question of what constitutes a substitute? Are there several? Just one? How does that work?
There are several. There's a chemical, a class of chemicals called hydrofluorocarbons, which apparently work quite well and don't have the same heat trapping ability. There are apparently carbon dioxide itself can be used for refrigeration. While carbon dioxide, on a worldwide scale is a problem when it's emitted, if it's done right and in refrigeration, it doesn't pose nearly the same warming potential as HFCs do. So there are a number of substitutes, and some American companies that have been have strongly supported this legislation because it will make sure that they're not undercut by those folks who are still making the old HFCs. And there's a lot of HFCs being imported from overseas.
Thanks. I just thought that if we had a question about that, we should be able to give some kind of an answer, if we were there in person.
Yeah, and a number of the companies and the including the Chamber of Commerce have written in and described at some length what the substitutes are, and that they are not more expensive, and in some ways will save consumers money.
Mm-hmm. And David, sort of the flip side of that, there are some that don't. Boeing was one of the ones that said there isn't, and how that's handled. And then we'll go to Ursula and then Bill Alsmar Johnson for questions.
My question is about the EPA comment and use of confidential. I assume you're referring to the HIPAA laws as being helping or securing the privacy of the patients.
Correct.
Is what, yeah, okay.
Bill?
Yes, I just want to know if the replacements for HFCs, are they compatible with the current air conditioning and refrigeration systems like refrigerators?
Some are, some aren't, is my understanding. But there would be no requirement that anyone has to replace now their existing equipment. Its own the requirement ramps down the amount of new material that's available, so that when you have to replace something, it's likely that you would get a replacement that would use the new materials. But no one is going to be required to get rid of equipment that they have now, although there would likely be some requirements for large users, not to do proper leak detection and leak prevention.
Very good. Bob?
Yeah, David, if I recall correctly, this is actually a phase down over, is it 15 years? So there's no abrupt requirement or abrupt change that's required?
That's correct. Yeah, 15-year phase down, and it phases down 85% of the current level of HFCs, so that there are some uses it's expected that will still need HFCs, like asthma inhalers. Apparently, they don't think the new replacement refrigerants would work for those. So the 15% that's left at the end of the 15 years will be for those few uses that still require HFCs.
Mm-hmm. Okay, and then just to wrap that up then, David, if you could just comment again on some of those, like I'm thinking again about Boeing, who is saying, there aren't replacements. But if we recall, in the name also of this act is the word innovation, and how maybe this is what the exceptions are and what is hoped for as we move forward in terms of spurring some innovation to look at some of these things.
Yeah, Boeing's comment was kind of curious. I mean, they didn't actually oppose the legislation, but they expressed concerns about whether could be some uses that affect them that they need HFCs for. They didn't really address the fact that only 85%, we're only phasing down 85%, and there's this 15% cushion that should cover whatever HFC needs they still have at the end of the 15-year period. And as you point out, part of the point is to spur innovation, and it may well be that we come up with ways to no longer need the HFCs that Boeing is concerned about. But yeah, I didn't find their comment to be very compelling. But yeah, that's one of the objections that's been raised. We need more exemptions for this and that. The other one involves a preemption of state requirements, because the federal government has, since the Trump administration came in, has not been doing anything about HFCs. A number of states have moved forward with requirements, about 17. And Chairman Barrasso has said that he doesn't want any bill unless it preempts all those state efforts. Environmental groups especially are very much against preemption, because under the Clean Air Act itself, it's been the long tradition that states are able to impose stronger air pollution requirements than the federal government, and they've needed that ability, especially during administrations that have been, anti-environmental, and they don't want to give that up. So that is, it may be something that compromise can be worked out on, and that may be the way this gets out of committee. But anyway, that state preemption issue is out there.
It's a big one. Yeah. Thank you very much. What we'll do, I'm going to take you over to the website to show where the action alert is and the additional information. And I think we'll stop the recording at this point then. Thank you very much, David. And this issue isn't going to go away during this particular 116th Congress. Our expectation is that it'll be reintroduced. It is, to remind you, bipartisan, bicameral, which gives it a good likelihood that, you know, even if it doesn't get passed this year, that it will be reintroduced. Any further comment on that, David?
No, it looks like Jack has a question. He's been raising his hand for a bit.
Oh, yeah, I can't.
Okay, can you hear? Oh, yeah.
Yeah.
Yeah, okay. Since Senator Barrasso is the holdup, I decided, in my letter, I mentioned that, you know, that the letters collected at River Road. But you know, last time I was at the Senate, at Van Holen's office, I picked up the card of his environmental, Megan Conklin, policy advisor for energy, environment, and agriculture. And I thought, well, why not send her an email about this? And I did yesterday. And what I emphasize, and I told, you know, I sort of pointed, I said, why does Senator Van Holen go to Barrasso with arguments? And one of the arguments is that the projected gains of 2.5 million jobs and $621 billion in economic output for this bill, that's the projected gains. We're in a pandemic where the economy has crashed. This is a very strong argument. This is a bill that will promote jobs, a lot of jobs. So I thought, you know, that would be an argument that Senators Cardin and Holland could bring to Barrasso. Look, you are stymieing a recovery. So that's my comment.
Good
And
point.
just to remind people also about the book that's come up before about the drawdown book by Paul
Yes.
Hawkins. This is the #1 issue. I mean, this is the #1 area that could make the most difference.
Absolutely.
You know, so let's remember that as well. So, and if you don't have that book, you would. It's very well done in that it takes a lot of innovations and solutions and lets you know what kind of change it will make and what kind of impact and cost as well. So thank you, David. And let's see. I don't see any other hands raised. And is there anybody else? Otherwise, we'll move. Very good. I'm going to stop the recording at this time, go to the website real quickly. Then we're going to move into a presentation. Tanner, I'm going to put you on tap for some of our talk about training. And also we will mention, maybe just before that, the briefings that we did have. As you know, we all talked about doing more webinars, and several of you were on that, and I'll ask for your input. So have I stopped the recording? I think I did. No, I haven't. Let's see here.